Patients with cancer often receive care from many different professionals across various settings. Many of these patients have 2 or more chronic conditions. This can lead to a delayed cancer diagnosis, poorer adherence to their treatment, lower satisfaction, and higher mortality than patients with one condition. For this subset of patients, there is a need for a more integrated approach. Integrated care planning can improve these experiences and outcomes. This is Sue. She is 65 years old and has coronary heart disease and hypertension. She was also recently diagnosed with stage 1 breast cancer. To treat and manage her chronic conditions, Sue interacts with more than 15 professionals across different healthcare settings, such as her cancer center, community hospital, and primary care clinic. Everyone is working hard to help Sue. However, with so many healthcare professionals working individually, her care has become more fragmented and more reactive than proactive. Her cancer providers have not been informed of Sue's pre-existing conditions. Results of her cancer assessment have not been shared with her family doctor. Her family doctor and cardiologists have not been informed of potential side effects of her cancer treatment. And a review of the medications prescribed to Sue by different professionals to check for potential omissions or interactions has not been done. Although Sue receives high-quality care from each professional she interacts with individually, she is frustrated that collectively they seem to lack information about her medical history and overall care needs. This is where integrated care planning can make a difference. Integrated care planning is an anticipatory process that involves thinking ahead and planning for expected changes in a patient's health, as well as what a patient's care should look like over time and across professionals and settings. Integrated care is also collaborative, bringing together many different stakeholders, including patients and their caregivers, to provide personalized care for each patient. Based on a review of best practices, CCO has developed an approach to integrated care planning, and it is organized into 4 phases: identify, assess, plan, and manage. Let's see what this could mean for patients like Sue and the professionals who care for her. In Phase 1, identify, Sue's family doctor suspects she has cancer and makes a comprehensive referral to the cancer system, where Sue is diagnosed as having stage 1 breast cancer. In Phase 2, the assess phase, Sue receives a needs assessment at the cancer center. She is found to have multiple chronic conditions and is deemed eligible for integrated care planning. It is important to note that while all patients can benefit from integrated care planning, those who are likely to benefit most are patients diagnosed with advanced cancer, multiple chronic conditions, who require palliative care, are socially or economically vulnerable, or are frail or elderly. Moving into Phase 3, plan. A personalized integrated care plan is prepared for Sue with input from herself, her caregivers, and all the professionals who care for her. This integrated care plan outlines how Sue's care team intends to deliver and coordinate services for her over time and across professionals and settings. It also specifies Sue's own goals and preferences regarding her care. In Phase 4, the manage phase, Sue's care team meets virtually to assign roles and responsibilities for the various phases of care and identify how and when they will share information on her condition and treatment. This information is recorded in Sue's integrated care plan, which is shared with all members of the care team, as well as with Sue and her caregivers. Over time, Sue's care team continues to assess her progress and update her integrated care plan as needed. Using integrated care planning, we could take steps toward improving the health outcomes and experiences for patients with complex needs, like Sue, and toward planning through the patient's eyes. But we cannot do it alone. At the heart of integrated care planning and delivery are interprofessional collaborative teams that share information and come together regularly to design a high-quality experience for patients with complex needs. Through your collective knowledge and leadership, you are a mighty force for change.